Okay. Hi Mary, it's Kylie and I'm going to show you how to give the oral medication now. The first thing I would do before I went into the patient's room, I would check the physician orders, the medication record, and the Cardex. I did notice when I was going through my patient's MAR and physician orders, there was a few things that needed to be fixed on the medication record, as far as either the dose wasn't listed or the route. I did make notes on here, and if anything ever was wrong on the medication record, I would always verify it with the physician orders. So I would double check these when I was going to first give my medication. I would also check them at the nurse's station before I went into the patient's room, and then I would gather the pills and the medication, the MAR, the Cardex, and the physician orders, and I would then go into the patient's room. So I'm now in my patient's room, and my patient Luke here, I'm going to give him his medication. So I would come in, set my things down. I would then verify that I have the right patient by checking his armband. Then ask him, Luke, can you please recite your date of birth for me?
10/18/1985.
Okay. I'm now going to give you your medication for the morning. Do you feel comfortable with taking all of them at the same time, or would you like to take each one separately?
Nope, that's fine. All of them at the same time.
Okay. So the first one I'm going to give you is your ferrous sulfate, which is an iron tablet. It helps with iron deficiency. The next one I'm going to give you is your Prilosec, which will help with your excessive stomach acid, being you came in with an ulcer. The next one I will give you is your amoxicillin. This is an antibiotic. It's used to treat infection. The next one you'll have is your Wellbutrin, and this is an antidepressant. Here's your Lipitor, and this helps with your high cholesterol. And lastly, this is your Lotensin, and this will help with your high blood pressure. So if you could go ahead and take those, here is some water for you to take with them. Were you able to swallow all of them?
Yep.
And I didn't say this before I started, but I would check the 5 rights 3 times like I did say. The patient, the dose, the route, the time, and the amount. I then would ask if the patient needed any PRNs. Are you having any pain, Luke, or any heartburn, or?
No.
You have there are 2 PRNs listed. One is Maalox, which is used for acid indigestion or heartburn, and the other one is naproxen or naproxen. And I do notice the patient has an allergy to aspirin, so I would be extra cautious about giving the naproxen to the patient due to him having an allergy to aspirin. There is no aspirin in the naproxen, but they're both from the NSAIDs family. So I guess I would just be extra cautious when giving that PRN. And that naproxen is for pain. So after I had finished giving the medication, I would make sure the patient is feeling comfortable. I would then gather my things that I brought into the room, and I would exit the room. If I was to give him a PRN, I would check back in 30 minutes to an hour to see if it was having any effect, and as far as that, I would check back with the patient if he needed anything. I'm now going to put eye drops, give the patient his eye drops for the day. The first thing I would do is perform hand hygiene, which I would do anyways as soon as leaving the room after I gave him his medication. I then would let the patient know what I was going to do. I would check the MAR as far as the right eye drop and the dosage, things like that. Before giving the eye drop, I would look at the patient's eyes. I would look for any swelling, any redness, inflammation, any drainage that I noticed. And then would put my non-sterile gloves on. I would again, if I was just coming into the room, I would check the patient's wristband to make sure I have the right patient. Being I was just in here, I know that he is the right patient. I then would remove the cap of the eye drop, and I would put it with the top down on the table to avoid contamination. I then would take my Kleenex and I would ask the patient, Luke, can you please look at the ceiling? And I'm going to be putting it in the left eye, so I would have him tilt his head a little towards the affected eye. I would then take my Kleenex and pull down on the eye. I would take the drop and drop it right in the eye. And Luke, I would ask him if he could please close his eye. I would place slight pressure on the lacrimal duct to avoid the systemic circulation. I would then replace the cap, remove my gloves, perform hand hygiene, and then I would leave the room and I would chart. At that point, I would chart the eye drops, and I would also sign off on all the medication. And that is the end of the oral medication and the eye drops.